All right, welcome back, everybody. Um, this part of the session is going to be pretty interesting because we're going to see how did this model hold up in the COVID environment. So Kurt and Katie are going to talk to us from the unique perspective that they both have, and that is the leader of a state agency, so they can kind of see the landscape of what's happening in lots of different places. And they're both going to share some experiences about what they've noticed about community-based care and this approach, and how it's responded to COVID. So let me turn it over. I think, Kurt, you were going to go first. So Kurt Kelly with Florida.
Well, thank you, Wayne, and thank you, Glenn. And I'm always excited when I can make technology work for me, even with all the Zoom stuff. I'm sitting here last second trying to click on, but thank you. Hey guys, I want you to do something here. We started watching and paying attention to what was going on with COVID. I think the first conversation that our executive board had, made up of our lead agencies and providers, was the last week of January. We started hearing some of this and we said, we better start paying attention. Florida's used to understanding that hurricanes may come and we've got issues to address. And so we started talking a little bit about that. But I want you to go back in your mind's eye with me to about the second week of March. I know that's a little PTSD for most of us, but if you'll go back there and think about kind of what we didn't know and what we needed to know to address this issue. And quite frankly, guys, it was the Wild West. But I remember telling our team, um, we had just come out of a very difficult session. And I remember telling our team that this may be our finest hour because we're going to really need to work together because there's a lot of things coming that we have never dealt with before. And that's really what happened. And I think it is the finest hour for community based care because what we saw and what we were able to accomplish, as to compare if we were having to rely strictly on government to provide us the direction and guidance, I think we would have been in a lot worse position. And at the end of the day, Florida fared very well through this process. I'm very proud of our lead agencies and our providers and how we work together. But if you'll go back to that second week of March in your mindset, and if you recall, the headlines were beginning to become more and more alarming. And we were hearing a lot of conversations about how this was going to spread out across the nation. We were reading things about what was happening in Europe and in Italy and other places that there was just major death. And people were becoming very concerned about this. Some questions that were being asked almost immediately is what the heck is COVID? What is it? We called it the coronavirus initially. Then you got the COVID-19. What is it? And there was a lot of speculation of how it got transmitted. If you could go back in your history, just see all of the different things that were being said about that. Well, that's the world we lived in, and yet we had to address our issues with children and families, and we didn't get the luxury of saying, well, we hope we can figure this out quickly. We had to move right on it. We had to start talking about PPEs. Didn't even know what a PPE was, and we needed to understand how to get them. When we were initially there, I wouldn't say that any of our lead agencies provided had any real sense of having to have these personal protection equipment like masks or hand sanitizer, just the normal stuff we might have had. We began to try to find that very quickly, and there wasn't any to be had. And if you recall, you go back and remembering that if you ordered PPEs, let's say you were to get a KN95 or something, you put an order in, the feds had the right to take it from you. We had an order almost immediately. We worked with somebody, and it was coming in the port of Miami, and it was taken from us and diverted to New York. And so this was all happening around that second week of March. So it was very traumatic. We did not know exactly what we were going to do about removals. So when kids come into care, what happens if they've been exposed? What happens if the foster family's been exposed? What happens in a group home? How do our case managers go out there and visit? All of these were questions that just had no direct answers. And so we began to reach out to the Department of Children and Families, our agency that we work with. And quite frankly, they didn't have any answers either. So I want to tell you that one of the things I saw that really happened with our organization is that we were able to respond. We were such more malleable and such and so we could move very quickly, very nimble in the way that we could begin to address some of these issues. Um, we were able to anticipate some of the concerns that we were going to have to address and started addressing them long before we got the authority from government to do it. And frankly, it was the right thing to do. We began immediately. The coalition began to develop a information structure to make sure that I had Dr. Nellius, who works for me, actually write a quick brief on what is COVID, what are the experts saying, and we disseminated this out to our folks to be able to assuage many of their fears and be able to help them understand what COVID was all about. We provided a portal inside of our website that kept all the latest information and some of the experts that were putting stuff together so they could have the latest information and updating that daily on a daily basis. We began to have a conversation among ourselves about what we're going to do. We had multiple conversations on a weekly basis about how we're going to handle our removals, what we're going to do about foster families that may come in contact with COVID, began to work on even quarantine solutions. And so we worked on all this. All this was done pre-government engagement because they weren't able to. They weren't getting the full direction right then, if you recall. And we set up a task force a little bit later, a COVID-19 task force. But we had been having this, it wasn't officially named that, but we were having this task force's conversations on a very regular basis. When it came to PPEs, the coalition, along with some of our lead agencies, I wish I could tell you, I spent 2 or 3 weeks just constantly all weekend long working with trying. It was the Wild West. We were trying to find PPEs from all over the place, and everybody had some solution, but you couldn't really trust them. We saw a bunch of articles where people were putting money out, having them stolen. This was a strange time. I ended up working on a Sunday afternoon with a group of folks talking to some Bulgarian arms dealer that had a whole bunch of KN95s. We didn't buy them from him, by the way. But we ended up getting some through someone out of New York who had a connection into Shanghai, and we were able to get our orders. I went to our lead agencies; they put up the money, and we were out there, and we gathered and brought in a large supply, came into the port of Miami, and we were able to get that out very quickly. Here's one of the great strengths that we found. This is major cooperation, guys, and I think this is why there's such a strength. We've talked about this even in our 101 session yesterday. Of one of the values of community-based care is how you can all learn and come together, and it can be very collaborative. But in this process, we set up something called the Pony Express. We would get an order that would all come to a certain location in Central Florida, in Wildwood, Florida, where John Cooper's the CEO. He had 3 vans. When we got that order in on that day, we would load the vans up and get them out across the state. We could cover the entire state of Florida and have everybody's PPEs, their hand sanitizers, all of the stuff. We could have that out in one day. Where if we had to rely on even FedEx, it would have taken longer. And we did all of that, frankly, out of the goodness of our folks' heart. We would take it to one lead agency, they would take their portion out, and then they would send it to the next lead agency, and then they would get it out of all of their providers. And so this was a great collaborative effort. I can't wait to tell the legislature about this year. I hear all the time, "Oh, you guys do your own thing." Man, this was an unbelievable cooperative effort. I was very pleased and appreciative of our folks. We also began to look at areas like, and Katie, I'm going to let you speak here in a second. We also began to look at areas like televisits. We had telehealth programs, but how we could do televisits. We started doing this long before we got the authority to do it, and we were being told, "You can't do it that way." Yeah, well, we're going to do it this way because we're not going to put our families at risk, our children at risk, our staff at risk. And we began to have a lot of those conversations. Our lead agencies were amazing. They were very courageous in saying this is the right thing to do. And eventually we got the authority to do that. We began to work with the courts on how to deal with them. Some of the courts just shut down. Well, in our world, they just can't shut down. I mean, that's where we go in to find out about the process that we're going to have to utilize, and removals, and then reunifications and all of those type of things. And so we began to use some of the tele-access processes during that. That's a great lesson learned, by the way. And then even from the department, there was one Saturday afternoon, I was so frustrated, I called the secretary at home, and I'm good enough friends to call him and say, I told him, I said, sir, I got to tell you something. You guys are useless. I'm not getting anything from you. I need to make sure our people have essential personnel status, and I was getting nothing for that. And so we went on the website and found what Homeland Security said, that you could declare them this, and printed out the letter and told everybody to go make their own stinking badges and do whatever they've got to do to be essential personnel. But again, the department wasn't able to move that quickly. Now, here's the good news. When they did move, and when they finally turned their attention, probably mid-April, and we had been, well, maybe even before that, just a little bit before that, we had been sheltering already by this time. All across Florida had really shut down. And when the department did turn their attention, they became unbelievable partners of ours, helping us find PPEs. Actually, we helped them find the right vendors, because they were out there and they just couldn't get them, and we actually helped them quite a bit. I would say that the final area that was not as fast on the uptake, but we kept saying we needed help, was testing. We knew we needed to be doing a lot of testing. Finally, the department was able to get us access to testing, but our folks didn't wait around for the department. They went out there and found other resources and other ways to get testing. We did set up a quarantine place with the help of the department. One of the camps that we've done a lot of work with, we set up a quarantine for children that could go out there. And fortunately, we didn't have to use it. I think we ended up using it about 5 or 6 kids actually went to that. Our group homes were amazing. They put some great processes in place. And so when I told them early on this could be our finest hour, it really was. And it is quite evident what happens when you have I think Glenn talked about this the other day, what happens when you have a community function that jumps in and says, we're going to take care of these issues. We don't have to wait around and wait for permission for somebody to say, no, this is the right way to do it. We knew the right way to do it. And so with that, I'll turn it over to you, Katie, but I can tell you, I'm probably as proud of this moment as anything we've done in community-based care.
I couldn't agree more, Kurt. Thank you. And thanks for leaving me with the image of you and John Cooper riding on ponies delivering PPE across the state of Florida. But I'm Katie Olst. I'm the CEO of the Texas Alliance of Child and Family Services, and I have the privilege of representing about 150 community-based organizations in Texas. But when I'm around Kurt, I usually say I am the Texas Kurt Kelly. So I had some thoughts. And he says he's the Florida Katie, right? No, so I did have some thoughts jotted down. I was going to really talk today about kind of the heroic efforts of community-based organizations throughout COVID, and there are so many incredible stories. And I love to talk about the positive stories because that's what really builds the public confidence in our work. But I decided at the last minute to deviate a little bit because what this symposium and this venue is all about really is real talk. And so yesterday I was kind of reminded of the value of this symposium and some of the real talk we had in the sessions that I was in. So what COVID has really kind of brought home for me, and this is not just about Texas, really, it's informed by my peers around the country as well, but what COVID has really brought home is how fragile the relationship is between community-based organizations and the public institutions that call the shots. COVID really did bring out the best in our members and our CBC networks, but it also smoked out some deeper issues with how the system works. In the early weeks and months, it became a little like Lord of the Flies. You fend for yourself, grab the toilet paper, hoard the PPE, find and hold on to the supplies you need, and good luck finding reliable information that was really tailored to serving kids in foster care or in kinship care. And so public agencies around the country really turned inward to make sure that their caseworkers had their protection, that their workforce was supported, their staff were classified as essential, and that they had a seat at the table with the public health officials to decide on information dissemination. So what COVID highlighted around the country that was instead of community-based providers truly being an extension of the public agency, the community entry point for families to get the help that they need from the public system, we felt more like contractors and vendors than ever before. And at the same time, the work felt more local than ever before. And so there was a disconnect. And it was a bit isolating for our community-based organizations who felt at times on an island, really, scrambling to protect their staff, their kids, their diminishing resources. And except in regions with community-based care lead agencies, and we have 4 in Texas, those nonprofits reported to me they were really feeling supported by that lead agency who brought in resources, whether it was medical expertise, sanitation supplies, access to mental health services for the caregivers and youth. Community-based care worked during COVID because it was local and it brought people together. And I hope that as we reflect on COVID as a system, we can recenter around the need for a strong public and private sector. So in addition to the incredible stories of kids, our services to kids and the families, and the immediacy of the community-based care support to their network, what I also want to reflect on and what makes me really proud is that community-based organizations were bold enough to say, I need help. I cannot find hand sanitizer on Amazon. My workforce is struggling too. I don't know how to quarantine a bunch of teenagers or kids that have run away and are coming back. I need flexibility from rigid rules to serve these kids. I need resources to buy tablets so they can stay connected to their attorneys and their causes. COVID strengthened our voice, and we have absolute clarity and consistency in our messaging because everybody came together, and a lot of it was channeled through our community-based agencies or our state associations. And our headquarters, our state agency, and I think our federal government really listened to us because of that. These community-based organizations and their lead agencies were the canaries in the coal mine for what was happening on the ground. And I just want to put a plug in here for state associations like Kurt's and mine and all over the state, all over the country. These alliances, and particularly the National Organization for State Associations for Children, NOSAC, really harnessed and amplified these kind of canary voices. And I think we really need to celebrate that we did come together and there was a lot of consistency in our messaging and we were able to get through some of this noise and some of this regulatory confusion and information and misinformation confusion because of it. So Kurt, I want to give it back to you. And I also just wanted to ask you a little bit about your workforce there in Florida and how you all fared.
Yeah, good. I think we can probably move this little section, Katie, and I'll take off the first shot at it. Is lessons learned that were valuable, and quite frankly, it's lessons learned that I want to go to the legislature this year. Our session starts in March of this coming year, and we're going to put some material together. We're going to go with the department. We're going to go in there and talk about it. I'll probably leave some of my concerns about some things they weren't able to do. But I do want the funders, our funders, and policymakers to understand that because of community-based care, there was no time that our children did not have someone full attention and focused on them. And in a crisis situation like this, whether it's a hurricane that hits us or the one that may hit us this week, or it's COVID-19. We have dedicated folks who are not sitting around waiting for to be told and be given guidance. We had a situation where we were working with the department on guidance document, and I know they had to take their guidance down to the governor's office and to get that cleared and all of that stuff. I remember telling them afterwards, we appreciate that. We appreciate your guidance, but we're not waiting on you. We have to move on this. We've got children, we've got workforce, we've got providers, we've got all these folks that are hanging in the balance, and we'll go forward and ask forgiveness and not wait for permission, especially if it's the right thing to do. I would say as a workforce question, and that was become one of our biggest things, was how do we provide them the resources? And that's why we spent so much time going after PPE. When I called the secretary and kind of chewed into him after a frustration was, I had heard that the Department of Children and Families had about a 2 week supply for their child protection investigators. They had about a 2 week supply. That's it. Well, you know what we had? A 2 second supply. We had nothing. And I'm like, well, how the heck do you have a supply and I've got nothing? And so we we went. That's why we went out there and just did our own thing. And they had and they would take care of their concerns. And I don't blame them. I guess that's their primary. But we were. I think you said it right, Katie. We became sort of secondary in their thinking. Fine with us. We'll go out there and take care of ourselves. And we did. And then, frankly, our relationships with all these different vendors and so forth, the department ended up coming to us, and we were able to help them. Our workforce needed the PPEs. Our work, if anything, just to assuage the fear. Um, we eventually got gowns and full mask and everything for them in our service. But we put some processes into place of how to go out. If you're going to have to go out there, lay eyes on them, how to go out there. And I think because of that, and we heard some concerns, especially some that had got sick, and therefore we were worried that we'd have to quarantine the whole organization if somebody brought it in. But we really didn't run into a lot of that. We ran into some of that, but we didn't run into a lot of that. And I think it was because we were proactive in the conversation, but also we wanted to make sure during this time, remember, we cannot, I don't think we can understate or I'm sorry, overstate the fear factor that was out there. People did not know what this is going to mean. And we actually did have a couple of people, some of our folks that provided services that caught COVID and died. And so there was some of that. But the reality is that we felt that we were able to provide them the necessary resources and the right procedural processes without waiting on guidance. Now, frankly, the guidance came fairly quickly. But if it ever shows you the value of community-based care, it is that when you are local and you can be a much more adept to moving and making right decisions quickly. I think that's what we saw here, and I don't know that we've lost a lot of our workforce. We'll see as we go into the next round if there's another round of this. But yeah, we did pretty well.
Yeah, to your point earlier, Kurt, about the legislature and making sure we tell our story. I mean, I think in addition to the wonderful stories of heroism and service that are abundant, we have a number of those stories. We plan in Texas to tell the story of the fiscal impact of this. It is so important that the private sector, the service delivery arm of the public sector, have a strong, skilled, tenured workforce. These are the folks working directly with children and families. And we estimate, based on our data and our surveying of our members, that COVID costs community-based nonprofits anywhere between $20,000 and $40,000 a month, and it's still going. Most of that cost, that unbudgeted expenses, are around retaining their workforce and supporting their workforce. These folks have families as well. They have kids home from school as well. So you've got to compensate them to come into work, or you've got to overhire and you've got to bring on other staff to be able to make up the work. Because as you said earlier, we're not going to not serve kids. So that all adds up to a significant amount of unbudgeted costs that are yet to be replaced by the state. So we'll be sure to tell that story. Now, I do want to put a plug in for the state of Texas, who did pass along some CARES Act funding to providers. And we are managing that through a down granting program, but it is nowhere near enough to make up for the expenses that COVID has brought, unbudgeted expenses that it's brought to the community-based providers.
We did. We had the same thing. The department was very good. Like I said, when they finally turned their attention, was able to get it. They did a lot. They provided a lot of resources, and still are. The CARES Act is sort of being pulled back now a little bit, and they're having to redirect some of those funds. But we had an outbreak just recently, and we had our testing process. And I called them and said, "I need some help with that." And they said, "Yeah, go ahead and do it." So there was a lot of positive things that came out of this. I agree the funding issue, and of course the budget restraints that are going to come. We already had to hold back 3% of the dollars that we had gone in. That's one of the effects of COVID. Florida has seen, even though I haven't seen the new revenue estimating conference yet. We were looking to have a substantial holdback this year again in this coming session. I'm not sure that that's going to happen. There seems to be, I mean, Florida's open for business, and our governor's tried to keep us open. Schools are back in all 67 counties. Our school districts are open. That doesn't mean everybody's going there, and our parks are down, and our shipping industry and our cruise industry has really been hurt. And tourism is a big portion of Florida's economy. So we're going to have those issues. But I don't know it's as big as we were concerned about. Well, I guess the part is no matter what happens there, our folks were adapting to this, and that was the key thing. If a state is looking to say what's a better system of care, community-based care gave us the ability to address the needs immediately and stay on top of it, and to bring that compassion. I said in 101 yesterday, the beautiful thing about community-based care is we have the capacity to love, and that's what I saw during this thing. I saw our people loving on their staff, loving on their people, being concerned for their children and families, and just finding a way to make it happen. And I was again one of our finest moments.
Completely agree. I think we're almost out of time, and I don't see any comments or chat questions, but it's great to be with you today, Kurt.
I'm looking to see, no chat questions. If anybody has any questions or anything, feel free to reach out. Otherwise, you've got 3 minutes. All right, thank you. God bless everyone.
Thanks, guys. That was awesome. Katie, I love your insight as to how this kind of tested the public-private partnership relationship, and certainly something we need to be paying attention to. That's critical. Kurt, I'm still trying to imagine you negotiating with a Bulgarian arms dealer. That's hilarious. So I need to hear more about that story. This session was brought to us by Neil McGarry and the Florida Certification Board. And I really want to thank them. They're doing some really cool things to kind of train and test the workforce in skills specifically related to permanency work and supervising permanency workers. I know Katie's had some conversations with Neil about bringing some of that to Texas, and we're really excited about it and think it's a good opportunity. So Neil, thank you for sponsoring us, and we are going to give everybody a break, and we'll be back in 10 minutes for our sessions to begin. So thanks, everybody.